Welcome to The Scoop from the Lurie Cancer Center's Adolescent and Young Adult, or AYA Cancer Program. We bring together AYA cancer survivors and experts to answer important AYA cancer-related questions. We hope you enjoy the conversation today.
Welcome to The Scoop. Thanks for being with us today. Today, we're going to talk all about physical therapy, exercise, and cancer. So we're going to get started with just a few introductions. My name is Bryn Fowler, and I am the program coordinator for the Adolescent and Young Adult Cancer Program at Lurie Cancer Center. Nick, do you want to go next?
Nick Alio with the Patient Advisory Board. I'm a cancer survivor and I'm looking to help those going through it right now.
Awesome. And Mary?
Hi, I'm Mary. I am a physical therapist at Lurie Children's, and I have recently been working with Bryn on revamping our involvement with all of our patients with cancer.
Awesome. Well, thank you both so much for your willingness to be part of this. Mary, we have kind of discussed a few questions that we want to talk with you about today, and we hope that everyone finds our conversation helpful. So maybe just to get started with, Mary, can you tell us a little bit about why physical therapy is important for AYA cancer, both patients as they're going through treatment and also survivors later on?
Absolutely. I think physical therapy is so important just across the lifespan and for everyone in general. But I think most importantly for patients that are undergoing a new cancer diagnosis or going through treatment and even into survivorship, we really want to focus on what their goals are and whether that's getting back to school, getting back to work, getting back to sports, whatever it is that they really like to do. I think physical therapy can be a huge asset to those things. And we just really want to keep our patients' goals in mind, and we try and improve their quality of life and making sure that they're living their life to the fullest and as pain-free as possible.
Just a quick follow-up question to that. Do you see people, regardless of if they're having an obvious issue with that might be related to physical therapy?
Yeah, so I think one of the ideas that's very common in physical therapy is that we're only there when something's wrong. Mm-hmm. And that's something that we are trying to change within the hospital to really try and get involved at the very beginning to really enforce things that are almost like preemptive, like really trying to put together home exercise programs in the beginning and really stressing why exercise and why activity is so important so that hopefully we don't get down the road to where something is wrong or where you're having pain or where you really need intensive physical therapy. I think PT can be involved from the very beginning to try and make sure that we're avoiding any of those hiccups later down the road.
Yeah, I like that focus kind of on the proactive.
Yeah.
Absolutely. As a follow-up to that, like when someone is diagnosed and given a treatment plan, I mean, so much is getting thrown at them at once. You suggest physical therapy be part of that discussion with everything else going on?
So yeah, that's definitely something that I think working with Bryn and working with our HEMONC team at Lurie, we're definitely realizing. I don't think I realized from the beginning how much goes into these diagnoses right at the beginning and how much families and patients are receiving. And we don't want to overwhelm them with just one more thing. And so we are looking to be involved, but also at the patient's comfort level. You know, if it's right in the beginning where they're like, we're really active, we don't have concerns. It's like, okay, great. We can, hold off for a little bit, but we do like to get involved with whatever level that the patient's comfortable with us getting involved in. But I think it's something we're also still kind of figuring out a little bit. I think every patient's different and every family is different, but we also want to definitely be aware that physical therapy can just be one more thing that's overwhelming the family.
But also one more thing that can help too.
Totally. Right. Absolutely. I think it's one of the cool things about physical therapy and something that I always like to say to my patients is I'm not a doctor. I'm not here to poke you. I'm not here to prod you. I'm here to play with you. I heard you love soccer and let's talk about your soccer games because I want to help make sure that your leg muscles stay super strong so that when you're not here, we get you back to soccer. Or I recently just had a 22-year-old that's like, I work at Target and I need to be able to do all these things that I enjoy doing at my job. And I'm like, great, let's just kind of listen to music and do exercise and have fun. But I think every patient's a little bit different, but it is cool to be able to say, like, I'm not the one that's coming in here to hopefully cause you pain. I'm hoping to avoid the pain.
Yeah.
Yeah.
that kind of leads into my next question, one that I tried to figure out as I was going along with treatment. I had chemotherapy treatment, and I was really trying to decide how much to rest, how much energy to exert to try to stay at a even keel level. There were some days where walking around the block was the hardest thing in the world, but I wanted to get some activity in to not fall too far behind. So I'm interested, how do you suggest balancing rest and exercise when it comes to somebody going through treatment?
Yeah, that's such a tough balance, I think. And it's definitely case by case, but the advice that I really like to give my families and my patients is when you're having those great days where you feel really good, is take advantage of those good days and do what you can. And then you're putting in the work on those days where you feel great. So then the days that you maybe don't feel so great, or you are a little bit more fatigued, you can take that day off and you don't have to push yourself as much through that day. I think sometimes reminding yourself that I put in the work on those days that I felt good, so that hopefully these days that I don't feel as great, they're not as bad as they could be. I think I like to remind patients that on those days where you are really tired, it's still really important to try and maintain your routine so that you're not totally losing a lot of that muscle mass. But your routine might also just be getting up to the chair for lunch or getting up to the chair for dinner, but just trying to do a little bit each day, and just especially taking advantage of those days that you're feeling really good. And I think the biggest piece of advice that I like to give my families is just to give yourself grace. So on those days that maybe aren't going as well, just allow yourself to have that day and just remember that there are going to be good days in the days to come.
Mm-hmm. Yeah.
I hope that's been helpful, or I hope that families have appreciated that advice.
Mm-hmm. Yeah, I think that's really good. What about, I think I can absolutely see the value when you're able to be in the room with a patient and working with them on various exercises. But do you have any suggestions of how patients can remain active kind of on their own at different points throughout treatment?
Yeah, I think that's, again, I feel like it's all kind of case by case, but I like to draw up exercise plans with whatever the patient likes to do. I have plenty of patients that like riding their bikes, but then I have some that hate it. So I think it's just reminding them to stay active in the things that they do like to do. And right now in COVID, that's a really hard thing to find because we are limited in a lot of the participation that we can do. But I think just getting outside and taking walks, that's a huge advantage to all of our strength and our endurance. So just trying to stay moving at home, or moving within the community as you're able, as it's safe. And I think just doing those things that you do enjoy, because even those small things really add up.
Yeah. You mentioned that you help write an exercise plan. Can you tell us a little bit more about that? Or if you have kind of guidelines across the board of what you recommend for how much time you should be active in a given day or anything like that?
I like to recommend starting at least 20 minutes of activity every day. And that can be as simple as taking a walk around the block, taking your dog for a walk, walking at Target, little things like that. Those minutes can really add up. And then just similar to the question that you had, Nick, where some days you're having those good days and bad days, really monitoring your symptoms in the days to come and seeing, was that 20 minutes maybe too much? And if it was, then maybe knocking it back a few minutes the next day. Or if you still feel great, then maybe adding a few minutes on. I think really monitoring yourself and monitoring how you're feeling is really important so that we just build up that endurance and build up that strength over time.
That's helpful.
Nice.
Mm-hmm.
That kind of leads into, you have another question related to that about caregivers and caretakers, the parents and the friends and the significant others who are helping people along while they're going through treatment. My mom was moved to Chicago basically while I was going through chemo to be there to help out. And it was amazing to have her, but we also probably fought and bickered more than we ever have in our life about get out and do something. No, I don't feel good. I'm not doing anything today. It was a tough balance, and we got through it. We're fine. We're good. But the question that I'm interested in hearing hearing an answer about is, what advice do you give to caregivers? Because that's a tough balance between motivating And I am so thankful that my mom did like push me on days where maybe I wasn't feeling like doing anything. What advice do you have for people helping those going through treatment?
Yeah, I think that's a tricky question, and hearing your perspective is really amazing for me. I think caregivers in this setting are just spectacular. The strength that they display on those tough days has just blown me away. And I think reminding the patients of their goals is really important. So it can even be a very short-term goal of like, hey, Nick, you mentioned to me that you want to be able to walk to the mailbox to get the mail, or, let's get up to the chair with physical therapy today, because that is going to be something that's going to get us one step closer to that goal. Or on like a younger level, you said that you wanted to be able to ride your scooter when you go home. Let's make sure that we keep those leg muscles strong by working with physical therapy so that we can get you back on your scooter when you're home. I think it's important to keep those big goals in mind sometimes. But then also when those goals are really overwhelming, I think I found it to be beneficial when you remind the patients of how far they've come. I feel like I have so many patients that every day starts to get a little bit monotonous. It's the same thing over and over again. And I have the great perspective of seeing patients on a little bit more of an infrequent basis. So I see those gains so much more, I guess, profound. So I like to, say, last week when I was here, you weren't even able to do this, and look at what you're doing this week. I think sometimes we can so often get caught on like, oh, just the day to day, I don't feel like anything's changing. And sometimes that external perspective of a caregiver can be, or a friend or anyone who's visiting, can be really beneficial for a patient. But I also have found caregivers that really use physical therapy and exercise as like, this is my time to peace out. And this is your time to do, what this physical therapist says, or the occupational therapist, whomever it is. And I think that's good too, because caregivers have to take their breaks too. And if we can provide that break, great, because, caregivers have to fill up their cup in order to be the best that they can be for the patient. So I think however it is that you need to feel that day and whatever you need to do that day is, I'm sure good for them. So kind of a long-winded answer for that question.
No, but I think it gets at the struggle between wanting to give, autonomy to the patient, but also wanting to be helpful and supportive in whatever ways you can as a caregiver. So that's helpful. I'm
sure. And there have been times where I've walked in a room and the patient's like, absolutely not. And the caregiver's like, no, you're doing it. And I'm kind of caught in the middle, like, do we want to do it? Do we not? Like, how do I approach this? And so those are, it's neat because you do start to create those relationships, both on the inpatient and the outpatient side, where you can kind of say like, to the patient, I know you've done this before when you haven't felt so well, so let's give it 10 minutes. And then that 10 minutes will be so beneficial for you in the days to come.
That's great.
That's so great. That's a great break for the caregiver and another person to lob a non-threatening suggestion to, stay active.
Totally. Yeah.
That's cool.
That accountability. Mary, have you heard anything in all of your work with patients about things that they wish they would have known sooner as it relates to physical therapy or exercise?
Yeah, that's a really good question. I think kind of similar to what we talked about in the beginning is that physical therapy can be involved at any stage. You don't have to be there when there's something that's necessarily wrong. If you're coming into this cancer journey where you want to stay active and you want to maintain your strength and your endurance the whole time, we can be involved from the start to try and prevent any of those hiccups or any of those deconditioning phases. I think so often we're only thought of when there is something that needs to be worked on. And I have heard patients say, like, I wish I knew you were here way before we got to this stage. And I think that's one of the reasons we are pushing so hard to get involved a little bit more, because there are times where patients are not feeling great. And that's when they need physical therapy the most. But they don't know us on those good days. They only know us on those bad days. And no one wants to have that relationship with a patient where they just know you and you're the person that's coming to get you out of bed when you feel your absolute worst. I think what I've heard from patients is like, I wish you were new, or I wish I knew you were here right in the beginning. And I think that's really one of the drivers that has led us to try and get a little bit more involved in this population.
as you're trying to get more involved in the patient population, like because I don't think when I was going through it, so I was 28 years old, I don't think I even would have thought I need physical therapy. I was like, I'm in like the best shape of my life, like I'll handle this fine, and I ended up getting to the point, like I said, walk around the block was tough. Is that a group that you're targeting more than usual? Is like, or is it? I mean, all ages, obviously, but have you seen trying to go, I guess, after younger patients a little bit more?
So I feel like it definitely varies. I think our younger patients, it's, if anything, a little bit easier sometimes because you can kind of trick them into playing like a game of Uno or Connect Four. Like you bring it in and you're like, well, I'm going to put it all the way over here on this side of the room and you got to come walk to me. And I think those patients are the patients that you very quickly realize that they need a little bit more help, because when they can't get out of bed by themselves, you're like, oh, I can see this very evidently. I think the older population, like our teens and our young adults, they tend to hide it a little bit better because they can get up and they can walk to the bathroom and they can sit in the chair and they'll be great. But then where we start to come in and we start to challenge them a little bit more and get them out of the room and get them to go on walks, and we start to give them some more exercises, I find that that's where we start to uncover some of these things that may be a little bit harder for them, and hopefully uncover them as early as possible so that we can intervene as early as possible. But I find both populations to have their challenges, but I think the young adult and the teenagers, as I said, I think they can hide it a little bit better, but hopefully by getting involved earlier, we are tracking them over time to say, at your last session, this is how far you were able to walk. At this session, this is where we are now. How can we help make up that difference so that we're keeping you at the level that you want to be at to help maintain all of your goals and your quality of life?
Mm-hmm. Great.
And that leads in pretty well to the next question I wanted to ask. Want to ask about success stories. Like, what are some of your favorite ones that you can point to and like really be, a great example of what can happen when, addressed correctly? I
feel like it's such a privilege to be able to work with any of these patients because you become such a part of their lives. This isn't, something that you just see for a couple of weeks and then they go away. They do stick around for a little bit longer. So I think I love working with this population because you get to know the family, you get to know the patient so much, and you really can watch them progress over time. I recently had the opportunity to work with a patient that during his admission, he had quite a bit of a decompensation and he ended up in the ICU. And when he was in the ICU, when I went down there, he was like, Mary, things are just not going well. And I was like, okay, well, let's see what we can do today. And he's like, I think I can only sit up in the bed. And I was like, okay, well, let's sit up in the bed. And then I was like, well, hold on, your sheets are kind of messed up over here. We got to get you over to the edge of the bed. So we get him over to the edge. And I was like, well, why don't we just change the sheets? Let's get up and we get him. Let's go into the chair. And he gets to the chair and he's like, that was really hard. And I was like, but you didn't think you could do that. And so it's just like those little things that are really exciting. And he had his good days and he had his bad days, but he actually just recently got discharged a few weeks ago and he was walking multiple laps around the unit. And he saw me one day and he was like, what have you been doing? Why haven't I seen you lately? And I'm like, well, look at you. Do you really think you need me? Or what do you think? And he's like, yeah, I guess I only see you like once a week now, right? And I was like, yeah, think of how far you've come from that day in the PICU where you were feeling so hot. And he's back to working and he's doing just such great things. And it's just nice to see how far they come, but also remind the patients of how far they've come. And I've loved being able to be involved in his care.
I feel like that speaks so much too to what you were talking about earlier, how some of those just seemingly small things can add up and really make a difference in the long run. That's a great story.
Totally. I know they seem small, but those little things of just putting your socks on in the morning or standing up to take a shower, while they may seem like the hardest things in the moment, those are the things that really add up to make sure that your muscles stay strong and your endurance stays up to snuff.
Yeah.
Really cool. for those who are out of treatment, maybe they didn't see you during treatment at all. Is that still an all right time is there a too late?
No, never. I think physical therapy is appropriate across the board for every person across the lifespan. I think, especially with patients that have had cancer, these effects you may not notice until you try to do certain things. I think when you're going through this, it's hard to know exactly how your body's going to respond to everything. But I think at any point, if anything starts to bother you, I would always recommend physical therapy. On a personal side note, my mom had cancer, and she years and years and years down the line was like, I can't hold my tennis racket the way that I used to. And I was like, that was probably from your surgery. Oh, wow. And she went back to physical therapy years later, and she was like, yeah, it does. I'm now able to get a little bit more range of motion, all these different things. And I think just always encouraging patients to follow back up, because it might be something that you may not think has anything to do with it. And maybe it doesn't. But either way, if you're having something that you're having difficulty with, absolutely follow back up with physical therapy, because that's why we're there. We just want to make sure that you have your best quality of life and you're doing everything that you want to be doing.
Yeah. I think to that point, Mary, if someone wants to get in touch with a physical therapist, is not currently in touch, do you have any, I know this is probably location dependent, but do you have any suggestions of how patients can advocate for themselves to engage someone like you?
Absolutely. I think speaking with either your pediatrician or your primary care doctor about whatever it is that you're having difficulty with, they'll screen for like the big obvious things that they may not want to send you straight to physical therapy for. But once they feel like they're confident it's a musculoskeletal component, they would be, I'm sure, happy to send you to physical therapy. And there's so many places right now that are, physical therapy seems to be on like every street corner in Chicago. And I think just reminding yourself too, find a therapist that you mesh with. There are probably plenty out there that you will get along with, just as many that you might not. But you're going to be working with this individual, so it's important to have a good relationship. And if you don't strike it right from the start, then, ask to see a different therapist or keep seeking out someone until you feel like you've found a good match.
Great. And then I got a question that I'm thinking of now along with that. And I'm not sure if it's answerable, but just to make sure the patients know, would this be, if it's accepted by their primary care physician, accepted by most insurances?
Yeah, so that's a great question. I think every place is a little bit different, but most places should have their insurances that they accept on their website, or alternatively, you can always go onto your own insurance's website and look up where your insurance covers physical therapy. There are plenty of places too that in the state of Illinois, you don't even need an order from your doctor. The only I kind of forget about that sometimes, because as part of a hospital system, we still do require an order from the doctor, but we do have the advantage of, in Illinois, we do have direct access. So especially for the more of the young adult and the adult population, I'm sure there are plenty of places that will accept you without a referral from your doctor. And then likewise, if they feel like there's something maybe bigger going on, they should have no problem sending you back to the doctor just to make sure that everything's okay.
Great. So to make it clear, the steps would be like, once you're diagnosed and you got all kinds of stuff being thrown at you, try to remember physical therapy, remember it, and then ask your doctor for a referral, or, explain kind of what's going on, check the insurance, and then find a place that works for you and your personality with the right therapist. Would that be accurate?
Absolutely. And I would say it doesn't have to be at any stage of the game, or I guess it can be at any stage of the game, whether it's right in the beginning, the middle, the end. I would say if at any point you find that something just isn't going the way that you want it to, physical therapy is there to help. And it can be as simple as, my child or the patient is having a hard time riding their scooter, to now my patient or my child is having a hard time sitting up in class because their back is bothering them, or it's now becoming too difficult. I think we have a role in so many different aspects of life, and we just want to be sure that we're getting involved at any stage of the game to make sure that you can reach your goals.
That's awesome. It's so exciting to hear just about the myriad of ways that physical therapy can be beneficial for folks. So Mary and Nick, I want to thank you both so much for taking time to talk with us about this today. I know I've learned more about physical therapy, and I hope others do too. So thank you again.
Thank you, Bren. And thank you, Nick, for sharing so much about your own journey. It's been a pleasure to listen to it.
No problem. Thank you for sharing so much on the physical therapy side. I wish I would have gotten involved in it back when I was going through treatment. So it's great. I hope people, patients will jump at that opportunity.
We hope so too. We like being involved. It's fun.
Yeah, love it. All right, well, take care, and thank you guys.
Thank you so much for joining us today on The Scoop. We hope you enjoyed our conversation and learned something new. If you want to hear more of these in the future, make sure you like our page at Lurie AYA. We hope you have a happy day.